She came into my clinic with a long history of high blood pressure, sometimes as high as 220/120. But what caught my attention wasn't just her blood pressure, it was her pulse. Her heart was racing at 130 beats per minute. Naturally, I was worried. Was this a heart rhythm problem, a thyroid issue, low blood count? So I ran several tests expecting to find something serious, but everything came back normal. And then something she said gave me the answer. She had been given a medication to place under her tongue, something many people still use when their blood pressure spikes: Nifedipine. And what I found next is something everyone needs to hear. Now, let's talk about this drug, Nifedipine. It was introduced in the 1970s as a revolutionary way to control high blood pressure. When taken the way it was originally designed, as a swallowable capsule, it works gradually to lower blood pressure safely. But over time, a shortcut emerged. People started poking holes in the capsule or putting the tablets under their tongue to make it work faster. And yes, it works fast, but that's the problem. This wasn't the way the drug was tested, approved, or meant to be used. It became a dangerous habit passed on in pharmacies, clinics, and even hospitals. And many patients never got the memo that it could actually cause harm. Here's the real danger. Putting Nifedipine under your tongue causes your blood pressure to drop too fast, and that's not actually a good thing. You see, the body doesn't like sudden changes. A very high BP like 200/120 is dangerous, yes, but so is dropping it to 130/70 within minutes. That kind of crash confuses your organs. Your brain, your heart, and your kidneys actually need time to adjust. If they don't, they panic. And that's when complications start. You see, this sudden drop can lead to fainting, dizziness, or even collapse. And in trying to fix the blood pressure quickly, you may be pushing your body towards something far worse. Let's talk about stroke. When blood pressure drops too fast, your brain may not get enough blood. It's like shutting off the water supply to a house. Things stop working. The brain is a very sensitive organ, and is sensitive to changes in blood flow. If that flow suddenly drops, even for a few minutes, brain cells start dying. That's how a stroke happens. And the irony is, some people take sublingual Nifedipine hoping to prevent a stroke, but they may actually be causing one instead. Especially in older adults or diabetic patients, a sharp fall in blood pressure can mean fainting, confusion, or a full-blown stroke symptoms like slurred speech or weakness. Now, let's talk about my organ of interest and specialty, the heart. When blood pressure drops suddenly, the body tries to fight back, and it does that by making the heart to beat faster. This is what we call reflex tachycardia. The heart senses that blood isn't reaching vital organs, so it speeds up to compensate. But in doing so, it demands more oxygen. And here is where it gets personal. The woman I mentioned earlier, the one referred to me with high blood pressure, she came in with a much lower blood pressure the very next day when she saw me, around 150/80. That may sound good at first, but then I noticed the heart rate, 130 beats per minute. I ran all necessary tests, her blood counts, her thyroid function, even checked for abnormal readings with an ECG, and everything was normal. Then she mentioned that what happened the night before, she had been told to place this same Nifedipine tablet under her tongue. And again, she was asked to do that same thing the morning before she saw me. Now, that sudden drop in blood pressure caused her heart rate to start to race to keep up. This is classic reflex tachycardia. Now, here is the danger. If she had underlying heart disease, even if undiagnosed, that racing heart could have pushed her heart into a heart attack. Because when the heart beats faster, it needs more oxygen. And if blocked arteries prevent enough oxygen from reaching the heart, the results can be deadly. So yes, sublingual nifedipine can lead to myocardial ischemia, a heart attack, and even sudden cardiac death. Now, in case you are wondering, maybe this is just Dr. Chuks' opinion, let me be clear. The use of sublingual nifedipine to rapidly lower blood pressure has been condemned by international guidelines for decades. In 1996, the US FDA issued a strong warning that sublingual or bite and swallow nifedipine had been linked to strokes, heart attacks, and even sudden death. It was never approved for that kind of use. Also, the American Heart Association and American College of Cardiology also clearly states that sublingual nifedipine should not be used in hypertensive crisis because of the risk of precipitous and uncontrolled hypotension. Also, the World Health Organization in its 2021 guideline completely removed sublingual nifedipine from its list of recommended treatments for severe hypertension, calling it harmful and no longer acceptable. Even the British National Formulary warns that the sublingual route is not licensed and may result in dangerous drops in blood pressure. So this is not just Dr. Chuks' thing. This is a global medical consensus. Sublingual nifedipine is outdated, unsafe, and should be stopped. So let's bring it all together. Sublingual nifedipine might seem like a quick fix for high blood pressure, but it's a shortcut that can cost you your life. We've seen how it can cause the blood pressure to crash, how it can lead to stroke, heart attack, and even sudden death. And we've heard what the World Top Health authorities have to say about this. This practice is outdated and dangerous. If you or someone you care about is being told to put nifedipine under their tongue, please pause, ask questions, and seek better care. Blood pressure should be controlled, not crashed. I'm Dr. Chuks, and I make these videos to help you make safer, smarter health decisions. If this video helped you, give it a like, and more importantly, share it with someone who needs to see it. You might just save a life. And if you'd like to hear more real patient stories and health advice that actually makes sense, please hit that subscribe button and turn on the notification bell. Your health deserves it.